In this video, we'll be discussing about dengue hemorrhagic fever. Dengue hemorrhagic fever is a fatal manifestation of dengue virus that manifests with bleeding, diastasis, and hypovolemic shock. These viruses are related to the virus that cause West Nile infection and yellow fever. It is caused by a pathologic agent and vector of dengue are called flavivirus and Aedes aegypti. Signs and symptoms, which usually begin 4 to 6 days after infection and may last up to 10 days. These include high fever. Sudden high fever occurs as a result of the infection. Severe headache. Severe headache also torments the patient. Damage to limb and blood vessels. As the virus is slowly spread, even the limb and blood vessels are affected. Bleeding. Bleeding from the nose and gums is a characteristic of DHF. Enlargement of the liver. The dengue virus could also penetrate the liver, causing fatal damage. And the last one is circulatory system failure. The circulatory system ultimately fails eventually in the disease if not treated promptly. Incubation period. It has an incubation period of 3 to 10 days after the bite from an infected mosquito. Pathogenesis. Several theories seek to explain the pathogenesis, including the selection pressure hypothesis. Claims that dengue virus varies and mutates as a result of selection pressure as it replicates in human and or mosquitoes, especially dengue virus. Diagnostic findings are dengue virus isolation, immunoglobulin titers, complete blood count, and decreased platelet. These tests confirm dengue. Medical management. The medical management of DHF is actually simple as long as it is detected early. Oral rehydration therapy. Oral rehydration therapy is recommended for patients with moderate dehydration caused by high fever and vomiting. Blood transfusion and blood products. Patients with internal or gastrointestinal bleeding may require transfusion, and patients with coagulopathy may require fresh frozen plasma. Oral fluids. Increase in oral fluids is also helpful. Avoid aspirins. Aspirin can taint the blood. Nursing intervention. Nursing interventions appropriate for patients with DHF include blood pressure monitoring, maintain patency of vascular access for fluid administration or blood replacement as indicated, medicating regimen. There must be periodic review of the medication regimen of the client to identify medication that might exacerbate bleeding problem. Fluid replacement. Establish 24 hours fluid replacement needs. Managing nosebleed and position the patient into a Trendelenburg's position. That's all my topic. Thank you for watching and stay safe. Bye!